Wir sind in Amsterdam, wo kürzlich der ESPGHAN-Kongress stattfand. Das wichtigste europäische Meeting der pädiatrischen Gastroenterologie und Ernährung. Teil des Programms war auch ein Symposium über die Ernährung von Kleinkindern mit Sojalebensmitteln. Das Symposium wurde von Professor Vandenplas geleitet, der vor kurzem eine Meta-Analyse über die Sicherheit des Sojakonsums bei Kleinkindern veröffentlichte.
The main outcomes was very simple, that soy is safe. At least what we mainly focused is on the safety of soy infant formula for infants, and soy infant formula was shown to be very safe for infants.
Kürzlich hatten einige spezielle Themen für eine gewisse Beunruhigung gesorgt. Darunter auch die Frage, welche Auswirkungen Soja auf das reproduktive und endokrine System von Kindern hat. Die Meta-Analyse erbrachte klare Antworten.
For the reproductive and endocrine system, the findings were the same as for the other parameters. It was very safe. No side effects in infants are reported. In fact, side effects that are reported are only in animals when you inject it intravenously, which has nothing to do with the daily clinical situation of ingesting some soy milk.
Manche Fragen betrafen auch erhöhte Phytoöstrogenspiegel bei Kindern, die Soja konsumieren. Auch hier brachte die Studie Klarheit.
If you measure phytoestrogens in the blood, they are higher than with mother's milk or with cow's milk-based infant formula, but never any clinical effect of these higher levels has been reported. Here the only side effects which are reported is if you inject pure phytoestrogens intravenously in animals, you get negative side effects, but it has never been reported in infants and young children. The take-home message of the meta-analysis is that soy is very safe and that soy can be considered as part of healthy eating habits for infants and toddlers. I think that soy can be safely used from 1 year onwards and that it is part of a normal diversified diet. There is no reason to not use soy in the diet of a 1-year-old child.
Das ist Dr. Messina, eine weltweite Kapazität in Sachen gesundheitlicher Vorteile von Sojalebensmitteln. Für ihn wird es immer klarer, dass Sojaproteine von höchster Qualität sind und ihren Platz in der Ernährung von kleinen Kindern verdient haben.
The soybean has a higher amount of protein than other commonly consumed beans or legumes, and the quality of soy protein is higher than all other plant proteins, and it's actually similar in quality to animal protein. Soy protein is very well digested, roughly between 95 and 100%, and it has an excellent amino acid pattern. So it meets all of the requirements for the essential amino acids or the indispensable amino acids.
Patienten sehen Soja oft als eines von vielen pflanzlichen Nahrungsmitteln an. Aber kann man die wirklich alle in einen Topf werfen?
In terms of protein quality, there definitely is a difference between soy and the other plant proteins. So soy is considered to be a complete protein because if you consume the amount of soy recommended by the RDA, you will get all of your essential amino acids, whereas in the case of other plant proteins, that's not true. Now, of course, you can combine plant proteins and come up with a high-quality protein, but soy protein is a high-quality protein in and of itself. But the take-home message is really that soy foods can fit into an overall healthy diet. You don't want to focus on one food too much, but soy is a food that warrants a larger role in Western diet. So I recommend that children consume at least 1 serving per day and perhaps 1 to 2 servings. And it's easy to incorporate soy into the diet because there are so many soy foods that are now readily available.
Ein dritter Redner des Symposiums war Professor Badger, Autor der Studie Beginnings. Diese aktuell laufende Studie umfasst etwa 100 Kinder, die von der Geburt bis zur Pubertät überwacht werden. Ziel der Studie ist die Erfassung des Wachstumsverlaufs von Kindern, die in ihrem ersten Lebensjahr mit Milch, Soja oder Muttermilch ernährt wurden. Bislang wurden Ergebnisse bis ins Alter von 5 Jahren veröffentlicht. Laut Professor Badger weisen alle in dieselbe Richtung.
I think that soy formula is an outstanding alternative to breastfeeding. We promote breastfeeding as the primary nutrition for infants, but most of mothers feed their children formula in the United States, and soy formula is clearly an outstanding alternative to that. One of the main questions that people ask is soy formula safe? And thus far we've found that soy formula is extremely safe. So we have studied this issue related to the potential estrogenicity of soy and find no evidence that soy produces any estrogenic effects. That's one of the reasons that we're going to also study these children all the way through puberty.
Für Professor Badger schließen diese neuen Daten nahtlos an bereits existierende Studien an. Zum Beispiel die Studie über die Leistung von 8-Jährigen, die als Säugling gestillt worden sind oder nicht. Die Studie zieht ein deutliches Fazit.
Children who are 8 years old and who were either breastfed or formula fed as infants and were studied at age 8 years perform at least the same. I think the take-home message is that soy formula is an outstanding alternative to breastfeeding. It promotes a very healthy growth profile. The body composition, which is extremely important in very young kids, is actually superior to formula fed in our mind. That is, the children are leaner, bone structure is healthier, and fat composition is lower. And growth characteristics are very good. So we think that that's an excellent alternative.